Hi there, my name's Melanie. I'm your student nurse. What brings you to the doctor's office today?
I have to get a physical for my ROTC in school.
And what's your name?
Blake.
And how old are you?
16.
Okay. So I'm going to go over this FHP. It's basically just a series of questions to get to know you better. So as I ask you questions, just answer them honestly. So, at home, who do you live with?
My family.
Your family? Okay. And do you use any community resources such as Meals on Wheels, adult daycare, or church group or community group?
No.
Okay. And have you been into the hospital recently? Have you had any other admissions?
No.
Okay. And how will you be planning to go home? By car?
Yes.
Okay. And do you have any allergies?
No.
Okay. Blake, do you take any medications?
No.
Okay. And what's your height?
I'm 5'11" inches.
Alrighty. And how much do you weigh?
210 pounds.
Okay. And Blake, do you use any tobacco substances?
No.
And do you drink any alcohol?
No.
Do you use any other drugs?
No.
Okay. And are there any other kinds of health practices that you use, such as massage, chiropractic, acupuncture?
No.
Okay. And do you use any mind, body, or other kinds of therapies, such as meditation, that can potentially affect your blood pressure?
No.
Okay. Now this will be about your nutrition and metabolic pattern. How's your appetite?
It's good.
It's good? Okay. And have you had any weight fluctuations?
No.
And do you have any difficulty swallowing?
No.
And do you have any dentures?
No.
Okay. Do you have any chip, missing, or loose teeth?
No.
Okay. Let's see. And this will go over your elimination pattern. So how is your bladder?
It's good.
It's good? Okay. So you're normal. Do you have any incontinence?
No.
Okay. How many bowel movements do you have usually during the day?
Like 2.
Okay. And when was the date of your last bowel movement?
Today's date.
Okay. And would you describe them as normal, or do you have any constipation, diarrhea?
No.
Okay. And now I'm going to ask you a couple questions about your activity and exercise pattern, and if you need any assistance with them. If you don't need assistance, you can just say no. Do you need any assistance eating or drinking?
No.
Do you need any assistance bathing?
No.
How about dressing and grooming?
No.
Toileting?
No.
Any bed mobility?
No.
Any transferring?
Nope.
Walking?
No.
Stair climbing?
No.
Shopping?
No.
Cooking?
Nope.
Home maintenance?
Nope.
Okay, good. Do you use any assistive devices, such as like a wheelchair or a cane?
No.
Okay. And how would you describe your activity tolerance?
Good.
Okay. Alrighty. Now for your sleep and rest patterns, how much do you say you sleep at night? Less than 8 hours, 8 hours, or greater than 8 hours?
More than 8 hours.
Okay. And do you take any naps during the day or at night?
No.
Okay. And do you have any difficulty getting asleep?
No.
Do you frequently wake up during the night?
No.
Do you wake up early?
I sometimes.
Okay. And do you use any sleep aids?
No.
Okay. Alrighty. Other than everyday kinds of pain, do you have any pain right now?
No.
And have you had so you haven't had any pain. And from a scale from 0 to 10, how would you describe your pain?
0.
Okay. How would you describe your body image? Would you say you're hopeful, powerless, or accepting?
Both.
And your self-esteem, would you describe it as low, medium, or high?
It's high.
Okay. And I'm going to say yes. And how would you describe your emotional status? Calm, anxious, angry?
I'm calm.
Okay. And your support system, How would you describe your support system? Like your family who you live with and family outside of your home?
Yeah.
Okay. And what is your occupation currently?
I'm in school.
Okay, so you're a student. And are you employed?
No.
Okay. So you're not retired. Let's see. Do you have any family concerns with anyone being hospitalized right now?
No.
Alrighty. Do you have any major concerns regarding hospitalization, injury, and illness?
No.
And have you had any major losses or changes in the last year?
No.
Okay, and do you have any other complementary therapies such as relaxation, such as yoga, meditation, anything of that nature?
No.
Okay. And how would you describe your religious affiliation? Like, what, are you an atheist? Are you Christian?
You have to ask my dog.
Okay. Are there any religious or cultural practices that may be affected by this hospitalization?
No.
Okay. Alrighty. So that concludes everything for the questionnaire. Now I'm going to take a set of vital signs on you. Is it okay if you take a seat right here?
Yep.
Thank you. And for the purposes of this video, I did practice hand hygiene, but I am going to sanitize my stethoscope. Alright, Blake, the first thing I'm going to do is I'm going to take your temperature. This is going to go in your ear, okay? And what I'm going to do is I'm going to pull your pinna up and back. Alright. So your temperature is 99.6. The next thing I'm going to do is I'm going to take your pulse. So, is it okay if I use this arm?
Mm-hmm.
Alrighty. So I'm going to use your radial pulse. Here, you can just rest it on there. Alrighty, great. So your pulse came out to be 75 beats per minute, and your respirations, which I was taking, I didn't tell you, so you would breathe normally, came out to be 16. And just to clarify, an adolescent's heart rate is normally between 55 and 95 beats per minute, and an adolescent's respiratory rate is normally between 12 and 18. Alrighty, and next for the vital signs, I'm going to take your blood pressure. Okay. Palm up. There you go. Great, so your blood pressure came out to be 120/80. So next I'm going to ask you, do you have any pain on a scale from 0 to 10?
No.
Alrighty. Alrighty, so next I'm going to do a skin assessment on you. So what I'm first going to do is I'm going to inspect your hair. Okay. So you show no signs of balding and you have a full head of healthy looking hair. And next I'm going to look at your nails. And then what I'm going to do is I'm going to blanch them. Okay. So the nails are firm and they adhere to the nail bed and there's no clubbing. And the blanching was less than 3 seconds. Alrighty, next what I'm going to do is I'm going to assess your skin. So what I'm going to do is it okay if you uncross your leg? So I'm going to assess the temperature of your skin using the back of my hands. Okay. Alrighty, so your skin is pink and your skin is dry and intact and warm. And also I'm going to assess for any lesions. And it looks like you don't have any, but if you did have any lesions, I would record it and then we would go over them further. So next I'm going to check your skin turgor. So this determines whether you're dehydrated or not. And basically what I'm going to do is I'm just going to pinch your skin up. And your skin did fall back down right away, which is great. So that means you're not dehydrated. Next what I'm going to do is I'm going to check your head and your face. I'm going to check the shape of your head and make sure everything is symmetrical. Okay. And next what I'm going to do is I'm going to look at your eyes. So I'm going to make sure they're symmetrical. Okay. Your eyes show no signs of drooping or infections, and also your eyebrows and eyelashes are evenly distributed. And can you blink for me? Okay, great. And you're blinking with ease. And next I'm going to assess your conjunctiva. So basically what I'm going to do is I'm going to pull your lower lid down and just assess. Okay. So they're pink and there's no swelling, redness, or foreign bodies present. Next what I'm going to do is I'm going to shine my light into your eye, and basically what I'm looking for is I'm going to look for the consensual light reflex. And this means that if I shine the light in one eye, your pupil will constrict, but also this one will constrict as well and vice versa. So they'll both constrict to the light even though it's in one eye. So I'm going to do that now. Great. And next what I'm going to do is I'm going to assess for accommodation. So basically what this means is I'm going to put my finger about 10 centimeters from your head and you're just going to stare at my finger. And as I move my finger closer to your face, your pupils will accommodate to my finger because you're focusing on it. So I'm going to do that now. Great. And your pupils are equal, round, reactive to light, and accommodation. Next what I'm going to do is I'm going to inspect your ears. So basically I'm going to palpate them and just let me know if you have any tenderness, okay? Mm-hmm. And the back of your ears. Hey, did you have any tenderness? No. Okay. And next what I'm going to do is I'm going to palpate your nose. Just let me know if there's any tenderness, okay? Mm-hmm. Did you have any tenderness? No. Okay, and next what I'm going to do is I'm going to check I'm going to check and see if you have any occlusions in your nose. So what I'm going to do is I'm going to occlude one side and you're just going to sniff. And I'm going to do the opposite. Sniff. Okay, great. Alrighty, so next for our assessment, I'm going to assess your mouth. So what I'm first going to do is I'm going to assess your lips and the shape of your mouth. And your lips are pink and symmetrical. And next what I'm going to do is I have my gloves on and I did proper PE. I'm going to pull down your lips and assess for any lesions. Okay, and there aren't any. And then can I have you smile with your teeth showing? Okay. And can you stick out your tongue? Okay. And then I don't have a tongue depressor, but if I did, I would assess the tonsils and uvula with a pen light, but what I can do is I can have you say ah, and I can check that way. Great, thank you. So next what I'm going to do is I'm going to have you take off your shirt. And is it okay if you stand over here? And just stand here and face me. Stand there. Okay. So now what I'm assessing is I'm making sure you're breathing normally and you're not using any accessory muscles. And you also have no signs of any barrel chest. Okay. And next what I'm going to do is I'm going to palpate for respiratory expansions. So can you turn around? So basically what I'm doing is I'm taking my hands and putting them on T9 and T10, basically in the middle of his back. Sorry, my hands are cold. Yeah. And then what I'm going to do is I'm going to pinch up the skin, and I'm just going to have you take a couple deep breaths. Okay? And one more. Okay? And this just shows that he's breathing normally, and the equal pressure is on both of my hands. The next thing I'm going to do is I'm going to also take your anterior and posterior thorax to make sure you're breathing normally. So everywhere I put my stethoscope, just take a deep breath, okay? All right, great. And can you turn around for me? Can you turn around? And just stand right here. Great. Now I'm going to also take the posterior. Okay. Now the next thing I'm gonna do is I'm gonna listen to your heart and just inspect your anterior. So what I'm gonna do is I'm gonna listen to your apical pulse, which is located at the left side on the chest at the 5th intercostal space at the left midclavicular line. So that would be about right here. Oh, you can breathe normally. Okay, so your pulse is regular and strong, and next what I'm going to do is, you can take a seat. You can put back on your shirt for now. Alright, so next what I'm going to do is I'm going to palpate your radial pulse. I have this hand, palm up. Okay, and next I'm going to check your brachial pulse. And next I'm going to check your pedal pulse, which is on the top of your foot. Alrighty, so all your pulses are +3, which means regular and easy to palpate. So the next thing I'm going to do is I'm going to assess your range of motions of your arms, shoulders, elbows, and legs. So just copy what I do. So what you're going to do is, to check the range of motion of your arms, you're going to bring your arms out in front of you, then you're going to bring them out as far as you can, then you're going to bring them to your side, then you're going to raise your arms up with the palm side down, and then you're gonna raise your arms, palms up over your head, and then you're gonna bring them behind your head and then behind your back. Okay, and then you can put them back to normal. So then what you're gonna do is you're gonna shrug your shoulders, and then you're gonna shrug them forwards, and then shrug them backwards. Okay? And next we're gonna check the range of motions on your elbows. So what you're gonna do is you're gonna bring your right arm up towards your shoulder, and then you're gonna lower it to straighten your elbow out, and then you're gonna bring your right arm up, palm down, palm up, and back down to your side. And then you're gonna do the same thing the other arm. You're gonna bring it up, touch your shoulder, and then what you're gonna do is you're gonna lower it back down, and then you're gonna bring your arm palm up, and then lower it down, and then back up and back to your side. Next, what you're gonna do is you're gonna bend your right knee up and straighten your leg out, and then put it down, and then you're gonna do the same thing with your other one, straighten it out. And then what you're gonna do is you're gonna bring just your right knee up like this, straight up, and then do the same thing with your other leg. Okay, and then can you sit down? And then just against my resistance, push against my hand. Like you're kicking your leg up. Okay, and then for this one. Okay. And then what I'm gonna do is I'm gonna have you stand up straight and face the wall. And what I'm gonna do is I'm gonna check your spine for scoliosis. So basically you're just gonna bend down to try to touch your toes, and I'm just gonna trace my hand along your spine. And your spine is even, but if your back was uneven, that would mean you have scoliosis. And if your spine wasn't straight, you would also have scoliosis. But your back is fine, you don't have scoliosis. Alrighty, and then can you sit back down for me? And I'm just quickly gonna go over your neurologic factors. So basically, I have you rate it as awake and oriented ×3 because your eyes are opening spontaneously, you're oriented to time and place, and you also obey commands correctly. Alright, Blake, so the next thing I'm gonna do is I'm gonna assess your abdomen. So just by assessing, your abdomen looks round and soft. The skin is dry and intact, and your hair is distributed evenly. You could just breathe normally. And I'm gonna listen for 1 full minute each, okay? Alrighty, and the next thing I'm gonna do is I'm gonna palpate your abdomen, and if there was any pain, I would save that part of the abdomen for last. Alrighty. And basically what I'm assessing for is any masses, and I would note the location, the size, the shape, consistency, surface, mobility, tenderness, and any rebound. Do you have any tenderness?
No.
Alrighty, great.